So here's what happens with the biopsy. This is the other scary thing, right? Some folks come in and they're like, okay, I think the biopsy, that uses a word that usually means a needle somewhere down here. That sounds pretty darn scary. You know what? It is scary. Don't let the doc tell you that it's not scary. When I tell my patients it's scary because you're getting a procedure, but any procedure is scary. A colonoscopy could be scary because you're put out. Here, the biopsy is something that we do routinely. Your urologist, or sometimes in some health systems, it's your radiologist that does it. So it's not just the urologist. But here, we are looking at specific areas of your prostate. So it's not like a blind stick in the sense that we're just jabbing the stuff. No, that's not it. It's a very systematic approach. And what you want now, in terms of standard, are 12 samples. Now, years ago, we used to only pick 6, and we would kind of rotate around the prostate. Nowadays, 12 is your number. And guess what? You're going to be empowered after this talk to know that for yourself. Because I see sometimes when it's a second opinion or a third opinion, I see sometimes on a report, you got 2 samples. And you think in 2016, is that at all possible? Yeah, it's possible. So you have to know yourself that, are you sure you put enough needles in here? Because I thought 12 was the magic number. 12 is the magic number. And once we get past 12, sometimes places around, even in the state of Michigan, might do up to 100 if you're really looking for something specific. But we don't do that routinely, so don't let that scare you, because I know from talking to some of my patients on some of the blog sites, they say that. I had a supersaturation biopsy, they went in 100 times. That's not the standard. There's a reason to do those, but when you're just starting out, 12 is your magic number. The other way is, how do you really know where you're going? That's where technology's gotten pretty darn fancy. So we use ultrasounds now, but there are men who they're aware that sometimes when we're kind of looking for prostate cancer and you're not sure where to go, sometimes they get MRIs. So that's the newest technology. And sometimes we do an MRI that's directing the biopsy. So we do that, a fusion-directed MRI, and most centers in the state of Michigan, including at our place, are doing that routinely. So they are using different technology that's higher tech to do that. But on the whole, your standard is still your 12-part biopsy. The other part that's happening is many centers are also recognizing that maybe before your biopsy, you got to take some antibiotics. And that's because that prostate is right next to your rectum. So when you do the procedure, there's a chance of infection. So we now know that, and most centers will swab your rectal area. They know what you respond to or don't respond to for antibiotics. The doctors give that right up front, and you're done. 1 dose, sometimes 2. And that cuts down on stuff we worry about, like antibiotic resistance, right? I mean, how many more movies are we going to see about that where we don't respond? That's a reality in our world, guys. So we don't want to just give antibiotics willy-nilly, and you don't want to take them willy-nilly. So you want to make sure that you ask your doc, hey, what's the prevention of an infection in this state? So again, you're empowering yourself. The other part is the anesthesia. So some places will use local, many places will use local, not too many places will use general. So they are really dependent on the hospital system you're at, but you want to go to a place that they do this fairly routinely, because I've heard too many stories where it hurts. If you do it right, it shouldn't hurt at all. At all. And I've had men who've had multiple biopsies trying to find prostate cancer, and guess what? If you had one that really hurt, you're not going to go for a number 2, right? So it's really important that you ask these questions.